Endometriosis is an abnormal condition when the uterine cavity lining is present in other places in the body. Most commonly, it's spread in the pelvis, across the pelvic organs, so bladder, ovary, tubes, back passage. These are the areas where it can be located. Also, it can infiltrate the uterine muscle as such. So in brief, that's the presence of endometrial cells from the lining in other positions.
How does endometriosis affect fertility?
In few ways. First of all, it irritates the abdominal cavity lining. So as a defense, women develop adhesions. And adhesions basically isolate these spots of endometriosis. But adhesions glue organs together. So the tubes with the ovaries can be with the bladder. And that's when communication between the uterine cavity for sperm towards the ovary for the egg is interrupted. But also, endometriosis can affect egg quality. The cells and the reaction against the endometrial cells in the ovary changes the environment, making it less favorable for egg maturation, hence egg quality is lower. And finally, this reaction against endometriosis is systemic. So it can circulate across the body and affect the endometrial lining quality within the womb, and implantation is less likely to happen.
And what are the symptoms and treatments?
The symptoms for endometriosis are quite non-specific. These are pain, these are spottings before the menstrual cycle. This is also propensity to develop endometrial polyps. So they're relatively common and relatively non-specific. So it's always a guesswork. And then the diagnosis is made based on typically laparoscopy, a belly button surgery, where we can visualize the lesions in the abdomen. They can be sampled and confirmed in the pathology as well. Treatment as such, well, it is fueled by hormones, just like menstrual cycle is fueled by hormones. These cells respond to the hormone changes as the cycle produces estradiol and progesterone. So we know for a fact that the disease kind of stops in pregnancy. So one of strategies is to make women like pregnant. So there's a choice of medication, often a type of contraceptive that makes women fakely pregnant. The other one is to stop a cycle on a different level using medications that basically stop the cycle on the brain level, that are GnRH analogs. And finally, there is always a surgical treatment, if possible, because sometimes the extent of the disease does not allow to do it safely. And that's when women have to basically live with the disease, but with medications.
And can I have endometriosis without knowing it?
Yes, it can be mute. So sometimes we are caught by surprise that despite all the tests looking normal, even the basic ultrasound that's performed as a bread and butter test for fertility doctors, they may not reveal endometriosis. And then once you do other tests, it can be MRI, it can be a blood test, it can be a laparoscopy, may reveal that there is endometriosis despite, not being visible macroscopically. In fact, quite a lot of women who have children have endometriosis and they don't know that.
And what advice would you give for somebody who might suspect they have endometriosis?
They will require a gynecological workup. So it's about seeing a gynecologist consultant and weighing the symptoms against the risks of surgery, about laparoscopy, which is still a golden standard to diagnose the disease.
Thank you so much.
You're very welcome.